I want to also thank Terence Young, Member of Parliament for Oakville, who's here with us this morning. Terence has been a passionate and long-time advocate for drug safety and will share some personal remarks in a few minutes. Canadians are fortunate to have access to safe medication that helps treat a variety of illnesses and diseases, but these same medications are also dangerous when they're not taken properly. In this regard, we know we can do better, which is why I'm pleased to launch the Plain Language Labeling Initiative. This initiative will improve drug safety by making labels and safety information easier to read and understand. Historically, information on drug product labels has been technical and confusing. Unfortunately, sometimes this results in people in misjudging the amount of medication they should take, and in some cases, people may take too much and suffer harmful side effects. Confusing technical drug labels can also lead to overdoses or other complications. In fact, as many as 1 in 9 emergency room visits are related to adverse drug events. 2/3 of these visits could be prevented.
Today, this minister and government are acting to ensure that the true risks and potential benefits of prescription drugs are provided to doctors in clear terms, and to empower patients to take a greater role in their own health care so they can take prescription drugs when they're safe. Most people don't think about drug labels. They trust their doctors implicitly. But when doctors get one-sided messages from drug reps and don't get the true safety picture about the drugs they prescribe, people can be injured or die. Drug labels are important as traffic lights. Drug labels are as important as fire alarms.
Working with Terence, it's given me a different perspective of the whole industry. Lots of lessons learned, learning process. A lot of people are involved in this as well. There's the patients, there's the pharmacists, there's the doctors and so forth. So it takes building those networks, communicating and working with industry. At the same time, we work with provinces and territories who deliver health care. So today, there's a number of partners involved in moving this forward. So it is the right thing to do, and it will provide better information to Canadians. And that's important so that we can make informed decisions as individuals, as parents, in protecting our children.
So we're here in Etobicoke in June 2013 to announce plain language labeling for prescription drugs. And it might sound a little bit boring because most people never even look at the label for their prescriptions. And the label's not the thing you see on the little bottle. A label is a document that's up to 60 pages long of 8-point print that even doctors find confusing. So the Ministry of Health today announced for all of Canada, and we're going to bring in new rules for labels for prescription drugs. So they're clearly worded in plain language with bigger fonts so even seniors can read them. So patients can be empowered to take a greater part in their own health care, and so doctors can tell if drugs are truly safe with the safety messages right up front on the front page, which is what they do in the UK and Australia and the United States. So it's an exciting day for me as Member of Parliament for Oakville. I've worked on this in Ottawa for over 5 years, but I worked on it actually since 2000, so it's been 13 years since I've been working to try and get changes so that drug labels have plain language and are clearly worded. Vanessa Young, our daughter, died in March 19th, 2000. She was 15 years old, and essentially the reason was because 4 doctors that knew she was taking the drug had not read the drug label, and they didn't realize that she shouldn't have been taking it if she had an electrolyte disturbance. She died of a heart arrhythmia. And this happens all the time in Canada. Sarah Carlin of Oakville died because she didn't know the true risks, the risks of suicide from taking Paxil. And it's happening to young people and people of all ages. In fact, it's the 4th leading cause of death in Canada, adverse drug reactions. So this is a generational change. I think my generation will be the last generation that takes prescription drugs without knowing the true risks and benefits and deciding if the benefits will outweigh the risks for them. So today's a celebration.